Gentlemen, let's talk about a topic that many of us, especially after 60, might shy away from discussing openly: masturbation. It's a completely natural, healthy part of human sexuality, and for many men in their later years, it continues to be genuinely important for both physical and emotional well-being. But here's what I've observed throughout my career in urology. After 60, certain habits, certain ways of doing things, can actually lead to discomfort or even potential health issues down the road. Today, I'm going to walk you through exactly how to masturbate safely after 60. And more importantly, we're going to dive into the 3 significant mistakes I see men make repeatedly, mistakes you absolutely need to avoid. This isn't just about pleasure, mind you. It's genuinely about your prostate comfort, your overall well-being, and making sure you maintain a healthy, fulfilling sexual life for years to come. So stay with me. This is important. Just a quick note before we begin. This video is for educational purposes and is not a substitute for personal medical advice. Always speak with your own doctor about your individual health needs. Welcome back. In all my years as a urologist, one thing has become abundantly clear to me. Addressing every aspect of men's health, even the most personal ones, is absolutely vital. Masturbation is exactly that, a normal human behavior that transcends age. For older men in particular, it can be beneficial in several meaningful ways. Some research suggests that regular ejaculation may support pelvic comfort and fluid turnover within the prostate. Though I want to be transparent with you, the evidence around prostate disease prevention is mixed. What is well established, however, is that it can serve as an effective form of stress relief and emotional regulation. These are not small things. These matter deeply to your quality of life. But here is the nuance I want you to sit with. Our bodies genuinely change as we age. Tissues become drier, sensation shifts. Habits that once felt perfectly comfortable may now cause discomfort or even subtle injury. So while the act itself remains beneficial, how you engage in it becomes critically important for your long-term comfort and your overall health. That is exactly why we are going to address these specific pitfalls directly and honestly today. Mistake number 1, not using enough or not using the right kind of lubrication. This is probably the most common oversight I see, especially in men over 60, and it is far more consequential than most men realize. As we age, natural lubrication decreases. This is simply biology, not failure, not weakness, just the reality of how the body changes over time. When you engage in any kind of friction without adequate lubrication, you are not only creating immediate discomfort, you are actively increasing the risk of micro-injuries to sensitive penile tissue. And in some cases, that kind of repeated tissue injury has been associated with conditions like Peyronie's disease, a condition that can cause painful curvature and significantly affect sexual function. The safe alternative here is both straightforward and effective. Make it a non-negotiable habit to use a high-quality lubricant every single time. Water-based lubricants are safe, easy to clean, and widely available. Silicone-based lubricants last considerably longer and are particularly well-suited for men with drier skin or longer sessions. Just keep in mind they are not compatible with silicone sex toys. And oil-based lubricants should never be used with latex condoms, as they degrade the material and compromise protection. Apply generously. Don't hesitate to reapply as often as needed. Think of lubrication not as an optional extra, but as a form of protection, a way of honoring and preserving the sensitivity and integrity of your most delicate tissues. After everything your body has done for you, it deserves that level of care. Mistake number 2, using excessive force or an overly aggressive technique. This one often goes hand in hand with the first, and it is something I address with patients more often than you might expect. Many men develop habits in their younger years where applying more pressure seemed to yield more sensation. It felt like more was always better. But after 60, that approach becomes not only counterproductive, it can be genuinely harmful. Overly vigorous movements, gripping too tightly, or bending can place significant undue stress on the delicate erectile tissues, the small blood vessels, and the crucial nerve pathways that make sexual sensation possible. This isn't theoretical. These kinds of repeated stresses can lead to bruising, persistent numbness, or even longer-term damage that quietly erodes the very sensitivity you are trying to enhance. And here is the irony. That aggressive approach often reduces sensation over time rather than intensifying it. My clinical advice for the safe alternative is this: slow down. Focus on gentle, rhythmic motions. Take the time to explore different techniques that genuinely prioritize sensation and comfort over force. Think slow, steady, and mindful. Let the pleasure unfold naturally rather than demanding it from your body. And please, listen to your body with the same attentiveness you would give to any other health signal. If something hurts, if something feels off or wrong, stop immediately. Pain is never something to push through in this context. Your body is communicating with you, and it deserves to be heard. Mistake number 3, neglecting proper hygiene immediately after ejaculation. This is a mistake that many men genuinely do not think about, and I understand why. It can feel like an afterthought. But from a clinical standpoint, it is incredibly important, particularly for men who may already have underlying conditions such as an enlarged prostate or diabetes, which can increase susceptibility to infection. Leaving residual fluids on the skin can create an environment where bacteria thrive, potentially leading to urinary tract infections, skin irritation, or persistent discomfort that lingers far longer than it should. The safe alternative is simple, and it takes no more than a minute or two. Always wash your penis and the surrounding area with warm water after ejaculation. If you prefer to use a cleanser, choose a pH-balanced, fragrance-free option specifically formulated for sensitive skin. Avoid harsh soaps that can strip the skin's natural protective barrier. And make sure you dry thoroughly. Moisture left behind can itself become a source of irritation. This small, consistent routine goes a remarkably long way in maintaining skin health and meaningfully reducing your risk of infection or irritation. It is, at its core, simple self-care, and men over 60 deserve to give that care to themselves without hesitation. So why does being this mindful about these practices matter so deeply, especially as we move past 60? It is not only about avoiding immediate pain, as important as that obviously is. It is about preserving your long-term sexual health and your day-to-day comfort. When you treat your body with the respect and care it has earned, you actively support better blood flow, healthier nerve function, and a meaningfully reduced risk of injury or infection. Every one of those things compounds over time. This is an investment in yourself, in your vitality, and in the quality of your intimate life for years still ahead of you. Let me leave you with a few key takeaways I want you to carry forward. First, listen to your body. Any pain, discomfort, or unusual sensation is your body sending you a signal. Don't dismiss it. Don't push past it. Honor it. Second, be open to exploring new approaches. As we age, what feels good genuinely shifts. Be willing to adapt your technique, to be curious rather than fixed. That openness itself is a form of self-respect. Third, frequency is entirely personal. There is no universally correct amount. Do what feels comfortable, healthy, and fulfilling for you. Free from guilt, free from comparison. And fourth, hygiene is non-negotiable, both before and especially after. It is a small step with significant benefits, and it belongs in your routine every single time. Now, I want to be absolutely clear about something. While everything I've shared today is here to promote safer, healthier practices, none of it replaces professional medical evaluation. If you ever experience persistent pain, any bleeding, unusual discharge, significant changes in sensation, persistent difficulty achieving or maintaining an erection, or any symptom that concerns you, please consult with your personal doctor or urologist promptly. Early detection and timely treatment are always, without exception, your best course of action. I cannot emphasize that enough. Gentlemen, masturbation is a perfectly normal and healthy part of human life, and that does not change at 60 or 70 or beyond. By understanding these common mistakes and consciously choosing safer, more mindful practices, you are genuinely empowering yourself. You are taking ownership of your comfort, your health, and your sexual well-being in a way that will serve you for years to come. That kind of proactive self-awareness is not something to be embarrassed about. It is something to be proud of. If you are ready to keep taking charge of your men's health, here is what I'd love for you to do right now. Hit that like button, Subscribe to the Thrive with Dr. Jocelyn channel and turn on the bell so you never miss practical, science-based guidance made specifically for men's health after 60. Drop your questions or comments below. I genuinely read them, and I may even address yours in an upcoming video. Thank you so much for being here today and for trusting me with something so personal. In my very next video, I'll be tackling another sensitive but critically important topic: understanding low libido after 60. Is it normal? And what can you do? We'll explore the common causes and discuss practical, natural strategies to help reignite your spark. You will not want to miss it. Stay informed, stay healthy, and keep taking charge of your well-being. I look forward to seeing you there.